Origin and insertion really for this, because we need to think about the muscle fibres. We've got a length of muscle fibres longitudinally if we're looking at infraspinatus, which are going in that direction. And then if we're going transverse to those, then we're going across. And we need to know where that is because we're going to try and begin in a transverse way. We're thinking of strumming the guitar strings because we're looking for that line of fibres where that potential trigger point can be found. And then when we find that line of fibres, we need to picture the insertion and origin and head off in that direction to see if we can find exactly where along that line of fibres that trigger point is. Sometimes assessment of trigger points can be enough treatment in itself. So you find the twitch response and then you try and get it again, it's gone. So let's have a strum across infraspinatus. How do I do this in a way that allows us to see as much as we can? Reinforce that thumb. I'd do it a bit better if you weren't all looking. Anywhere that stands out to you as particularly painful there, Darren?
Yeah, that.
Come from this direction. Sorry, Monica, you might want to move around. Oh, so I can feel a little twitch there. So as I come,
moving his fingers.
can you see that little twitch there as I move across? There's one. I can feel it more than see it. Okay, so let me know when we're at the most tender spot.
There.
About there, okay. So we know roughly it's going to be along that line, and helpfully Darren's got a tattoo so we can use that to sort of mark that. So we're going to move across, and the erythema starting to come in there as well. So we can move across now from origin to insertion. Let me know where we're there.
His mum tells me.
Yeah.
Big switch there.
There.
Just there?
Yeah.
Okay, do you feel that refer anywhere?
I can feel it coming through into the front of my delt.
Okay, so that's that usual referral pattern that we talked about. So we found it, so now we need to treat it. So at this point, you want to make sure that you're reinforcing your thumb or finger or knuckle or whatever you're using to get that pressure in a way that's sustainable for you, because you will be holding this for 1.5 to 2 minutes in most cases. So when I've found that, I know roughly where it is. I'm going to position myself here. So thumb there, reinforced, and in a good position that I can just lean my body weight in. And I'm going to slowly increase the depth until we get to a 6 out of 10 down. So let me know. The toes. Number?
Yeah, that's about it.
Okay. So what I need to do there is just relax as much as I possibly can. We're going to give it 20 to 30 seconds. Thumb relaxed, all the pressure coming in through the top hand. Deep breaths down. I want you to let me know when that starts to drop down. You need to make sure that pressure you're applying is consistent. Because Darren needs to be able to relax into it. Any drop yet?
It's just starting to ease off now.
Okay, so we'll give it another 10 seconds and then I'll ask again. Deep breaths. And what number are we at now?
Probably about 4 now.
Great, okay, so we dropped 2 points. Perfect. So I'm going to apply a bit more pressure until we're back up to a 6, okay? Deep breath in. And as he breathes out, just going to drop a bit more of my body weight into it. Say when we get there.
Yep.
Okay, which is good. There's a lot more depth there than there was before, a lot more pressure. I'm in a sustainable position, lean on the couch and on Darren. And what we're looking for here is a spontaneous relaxation of the muscle. And you can feel that, which is the most satisfying response because you know immediately the feedback that it's worked. And Darren will hopefully say as well, oh, the pain's gone. But as long as we're dropping consistently each time, that's what we're looking for. Number?
Probably about 2 or 3 now.
Brilliant. Okay, deep breath in. And breathe out, relax. So it's dropping, we know that we're not on a nerve or any inflammation. Let me know when we get to a 6. Number?
Yeah, probably about 4 or 5. It feels massively looser.
Good. And I'm really pressing into that scapula now, so I don't really want to go much deeper. I'm going to hold that for another 30 seconds now, ish. Let me know when we're at that 2 or 3 again, okay?
Mm-hmm.
Number?
Yeah, it's dropping right now, quite rapidly, probably about
Okay.
1
So
or 2.
we've reached the end of the technique. About 1.5 to 2 minutes, probably even a bit longer. How do we come out of this now? There's a few different ways. My preferred approach is just to slowly ease out of it, because what we want to facilitate here is relaxation, and we're not going to do that if there's any sudden abrupt changes. But that is one technique that you can do. You can also come off with just some light frictions as well. So I'll let you decide what you do and see which one. But my preferred way is slowly come off. As we come off, you start to see the erythema come in the shape of my hand. We probably want to avoid working that area too much more now. So make sure that you get the bulk of the superficial work done there. That's going to be the deep focus stuff. We can work around the rest of the infraspinatus.